vegetable focused, and encouraging people to cut down on animal foods. The keto diet does the worst.
Exactly. They are not looking at metabolism. Those are the big drivers of heart disease. Those are the big drivers of cancer.
Hi, Dr. Eric Westman here with Dr. Christy Kesslering, a metabolic medicine specialist and radiation oncologist. How about reviewing another video, someone else's video?
That sounds like a great idea. Hi, I'm Christy Kesslering, radiation oncologist and metabolic health specialist in the Chicagoland area. And I am so excited to announce for the first time ever that we are going to be doing a 2-day workshop called Interpreting Your Lab Tests Through a Cancer Lens. This workshop is just $20. And in part 1, we're going to be covering the why behind testing from a cancer perspective. What are the basic labs we usually get from our annual physicals or checkups, and how we can use those to help better understand our metabolic health, and maybe even looking into a few non-traditional labs and how to interpret them. We'll look at a few case studies and how we can adjust diet and maybe other things to optimize those outcomes. In part 2, we're going to be looking at a few more non-traditional labs, what they can tell us about what's going on under the hood. Again, when it comes to cancer, we need to look not at normal reference ranges, but rather what's optimal. How can we optimize our own personal health and use those labs to help determine that? So to join and to learn more, click the link in the description. See you soon.
This one was sent to me from nutritionfacts.org, and I've done some reviewing of this group before, and I'm afraid they got my plant-based biased stamp a few times, but we'll see. This one is the best diet for cancer patients, and let's see what they say.
Our lifetime risk of developing an invasive cancer, not like some superficial skin cancer like ductal carcinoma of the breast, but serious cancer, is about 40%. 2 in 5 of us are going to get a cancer diagnosis in our lifetimes. What can we do to reduce our risk?
So I think I'm going to stop right there. Is that really true?
Unfortunately, it is. It really, we are seeing more and more. I think if we live long enough, I think they say that 1 out of 2 men and 1 out of 3 women will have a cancer in their lifetime.
Okay, wow, that just kind of is shocking. It's so common. Let's keep.
Only about 5% of cancers are caused by problem genes we inherited from our parents. The other 95% are caused by mutations in our DNA we acquire in our lifetimes. For example, based on a genetic analysis of lung cancer, smokers may acquire an average of 1 DNA mutation for every 15 cigarettes smoked. Smoking is bad, but the #1 cause of these mutations is our diet. And that's not even including the cancers attributed to obesity. I've got tons of videos on dietary approaches to prevent cancer, but what if you already have it? Well-meaning professionals sometimes counsel cancer patients to eat whatever you want. Given the time constraints that doctors face, it may be understandable that the treating oncologist, the treating cancer doctor, may be reluctant to engage in a conversation about nutrition, but given the critical role that diet may play, perhaps it should be a critical part of their job to be able to answer patients' questions about nutrition before and after cancer treatment, and not default to the unhelpful, it doesn't really matter, eat whatever you want.
Well, let's stop right there. Really? Most doctors don't, or oncologists don't talk about diet?
I would say that most don't, or they recommend, some will say, please, let's eat more plants. I hear that a lot. I eat more fruits and vegetables. I actually had a patient who was a vegetarian and even a vegan, eating lots of fruits and vegetables, being told by her cancer team that she should eat more fruits and vegetables, despite having cancer while eating that way. What is actually more of a What is actually more interesting is how they really don't want patients to lose weight. So when I get a patient who wants to optimize their health and start cutting out junk food, and they start losing weight, but in the conventional world, unintentional weight loss is associated with worse outcomes, that it actually is associated typically with more advanced disease and cachexia, which is muscle wasting. And those patients tend to do worse, but they don't always disassociate unintentional weight loss from intentional weight loss. And what's really interesting is there was a study done a number of years ago. You probably are familiar with this, that the A to Z diet trial, where they looked at Atkins and Zone and a few others. And interesting, the Atkins diet, or a very low carbohydrate diet, was the one diet that seemed to maintain muscle mass, that the loss in weight was predominantly fat loss. Whereas the other diets, yes, you had fat loss, but you also had muscle loss. So I think it really comes back to not understanding the way in which we lose fat.
Yeah, the metabolism would be entirely different if you had really bad cancer and that's why you lost the weight, advanced, or if you were changing your metabolism to weight loss, but improved metabolism.
Correct.
I can see how that gets confused. Well, let's keep going. This is Dr. Michael Grieger with nutritionfacts.org.
Which may not be in the best interest of the patient. The official recommendation of the American Institute of Cancer Research, a leading authority on diet and cancer, is that those with cancer should follow the same diet that helps prevent cancer from taking root in the first place. That means more whole grains, vegetables, fruits, and beans, while limiting fast food, processed food, meat, soda, and alcohol. Similar recommendations have been put forth by other cancer authorities: more fruit, vegetables, whole grains, and beans, and less salt, sugar, meat, and alcohol.
Now, I'm just going to stop right there. What, do you do this? Do you recommend this?
Not at all. And again, this is data based on quote unquote expert opinion, but because they are surveying large populations of people and then trying to attribute the diet to the outcomes of those patients, where patients have a lot of things going on. And many of our population who eat red meat and maybe eat salt actually eat very highly processed diets, lots of processed grains and sugars and high fructose or sugar sweetened beverages and things like that. So unfortunately, these are out there and they're very prevalent, but you see it in your own patient population, not just in cancer.
This is the fallacy or the debate strategy of the appeal to authority. It sure sounds authoritative, but these world organizations are basing it on very weak evidence. Again, it's so authoritative.
Yes.
Not only one, but three organizations, and yet it's still based on such weak evidence.
And I think it's also been shown that a lot of the people that are on these guidelines committees often have their own biases, right? They're maybe already vegan or vegetarian or plant-based. And so they are, they're certainly preaching maybe what they do, but again, without the evidence to support those recommendations.
Well, I went to the American Institute for Cancer Research once, some years ago, and it was really, everyone talked about plant-based diets and cancer. There wasn't like any role and no room to even talk about eating an animal or an animal-based. So it was, my understanding of their bias was, I recognized that quite some time ago. And yeah, the unwillingness of some people even to acknowledge that they eat a certain way, that for a while in the low-carb world, people would get up and say, I just have to declare my conflict as I eat animals. Just to be in the face of those who say, I declare they wanted to have the other people declare their conflict that I think it's unethical to eat animals. That's a different reason than the science. But let's keep going.
Cancer survivors adhering to these guidelines do seem to live significantly longer, at least older female cancer survivors, the only group in which it's been looked at so far. They had that...
Well, time out. I can almost sense in his voice the, well, sort of, somehow seeming, and what was that? What was that, real science?
Again, back to observational data. We really can only make hypotheses.
Yeah, that's what I thought. Let's keep going.
Foods that may be beneficial in cancer care, including beans, berries, cruciferous vegetables, flaxseed, garlic, green tea, tomatoes, and others. But emphasize it's not about a single magic bullet food or component, but the combination of foods in a predominantly plant-based diet.
Uh-oh. Gotta get some plant-based bias there.
Here's how some popular diets used by cancer patients stack up. The so-called alkaline diet gets high marks for being vegetable-focused and encouraging people to cut down on animal foods. The keto diet does the worst, though they get points for keeping people away from refined grains, alcohol, and soft drinks.
So what's going on here?
Well, unfortunately, they're using the expert opinion to then judge every single diet.
Oh, right.
But they haven't
they're not looking at the...
Oh, I'm so sorry.
They're not looking at the glucose and insulin and
Exactly. They are not looking at metabolism. And we have so much evidence and in every category, mean that having higher insulins increases your risk of getting a cancer. Having a higher insulin increases the degree or the grade, the stage, the aggressiveness of the cancer. That having high insulins are associated with worse outcomes of cancer therapies or during cancer therapies. So if we judged every single one of these based on their impact on lowering insulin and improving metabolism, a ketogenic diet wins hands down every single time.
I see, but I can see how. So they set up a straw man, or here's the best approach, and now we're rating all the other ones against this best approach, we think, and without looking at the internal metabolic change. Well, let's keep going.
Macrobiotic diets, you really kind of win the day, being closest to a whole food plant-based diet centered around whole grains, vegetables, and beans, though may not be advising enough fruit.
But time out. But so more fruit if you're trying to lower insulin levels? I don't understand.
He does not understand insulin in any way, shape, or form, in my opinion. Now, maybe he does, but the fact that he continues to advocate for grains, legumes, starchy vegetables, and limiting foods that have very low glucose and insulin responses, it tells me he doesn't understand metabolism.
Yeah. Okay. Well, let's keep going.
Diets are a mixed bag with insufficient whole grains and beans and too much meat, and the vegan diet starts out strong, but doesn't necessarily preclude all manner of vegan junk food. Have any of these diets been put to the test? I've done a video on the abject failure of the keto diet. The alkaline diet was tried on 11 lung cancer patients. They lived an average of 28.5 months, which is about 40% longer than most patients have historically lived, but there was no direct control group. The only diet proven in a randomized controlled trial to reverse the progression of cancer was Dr. Dean Ornish's whole food plant-based lifestyle program, which I've covered before. Most randomized controlled trials to date on diet and cancer are like this, right?
So time out. That was pretty strong statement. Is that the only randomized trial that is the one that Dr. Ornish did?
Well, let's even clarify Dr. Ornish's trial, and he stated it clearly. that this was an intensive diet and lifestyle management trial. So not only did they put people on a vegan diet, which they then supplemented with protein, with omega-3s, with other vitamins and minerals that typically are lacking in a vegan diet, but then they also had exercise recommendations, I think meditation or some kind of mind-body exercises. They had numerous contacts with the dietitians. They had support groups, conventional or the control group. Just follow your doctor's recommendation. And so you can see there were so many pieces to that puzzle. Like maybe it was just the exercise regimen. Maybe it was the fact that they felt empowered and part of a group. Maybe, who knows? But we cannot isolate the diet and say that that was the reason for the benefit. And again, the benefit was extremely small. But there have been other trials. There are two breast cancer studies that come to mind, which were a low-fat, and I guess it wasn't a strict vegan diet, and maybe that's what he was pointing out, that this was a true 100% plant-based, but the other one was very heavily weighted to plants, and it had to be low fat, so you are cutting out a lot of animal foods because of the fat content, and in one of the trials, there was absolutely no difference, and in the other trial, there was no difference as a group, there was no difference in the ER/PR positive, there was a very, very small benefit in the ER/PR negative patients, so estrogen and progesterone receptor negative breast cancer patients. But in the Ornish trial and in that trial, those patients that were on the intervention, so on the diet, did have some weight loss. And I think we've spoken before, when we do any diet, low fat or low carb, we are cutting out combo high fat, high carb foods, which are the biggest drivers of insulin. In neither one of those trials or any of those three has there been testing of insulin and glucose and insulin resistance. And it would be very interesting to say, was that the reason that there was maybe a small benefit?
Well, yeah, so I sense that there's a little cherry picking, that let's not talk about the negative studies. Let's only talk about a positive one. And then I'm always waiting for the second study. And for the longest time, Dr. Ornish, give him all the credit for putting lifestyle on the radar for doctors, but his one study with coronary angiograms in 1990-ish, it was never repeated, was never replicated. And I'm afraid that some people just go out and do a study and then say, see, what needs to happen is a group independent of their own belief system and all that needs to replicate it. And in fact, I listened to something recently that he gave, and he said it was unethical to not use this now. Well, no, that a lot of people would study this. It's not unethical to do a second study, just put it in the hands of somebody else. But then that brings to mind the Women's Health Initiative study, which was a low-fat diet in 48,000 women, and it didn't reduce breast cancer over 8 years. So there are a lot of these negative studies, but and then he went by the keto. Has there ever been a keto randomized trial versus a vegan or plant-based for cancer?
There has not. I mean, most of the data out there is there's ketogenic versus the American Cancer Society diet. There are just ketogenic diets, prospective trials. There are ketogenic versus control. So anytime, again, we do any diet against control, we should see, hopefully some degree of improvement. But anytime we compare ketogenic diets to any other diets in any, discipline. So I really extend my research or my data collection outside of the cancer literature, because what we've already determined from the cancer literature is that it's about metabolic health. It's about reversing metabolic syndrome, lowering insulin. And there's plenty of trials in the endocrine world and the diabetes world, the obesity world, even the heart disease world, where they're looking at using ketogenic diets to reverse metabolic syndrome, to reverse diabetes. Those are the big drivers of heart disease. Those are the big drivers of cancer.
Well,
So I don't think, yeah.
Those dots haven't been connected, have they?
No.
Yeah.
No.
Well, back to the doctor.
Ability studies, just to see if you can even get cancer patients to eat healthier, period. Otherwise, what's the point of even running the study? Here they did find they could get patients with head and neck cancer to ramp up green leafy and cruciferous vegetable intake up to 9 cups a week, so it's at least something you could test. We don't yet have outcomes data, but why wait? Right? What's the downside of trying to eat healthier? It may even save your life another way. Cardiovascular disease competes with breast cancer as the leading cause of death for older women diagnosed with breast cancer. Researchers followed more than 60,000 women diagnosed with breast cancer over the age of 65 for an average of 9 years, by which time half had died. And the number 1 cause of death was actually cardiovascular disease, edging out the breast cancer. And so choosing a healthy diet centered around whole plant foods.
Well, but hang on. So that was an important point, that the metabolism, you may have cancer, but you may have problems with cardiovascular disease that get you.
Yeah, and I think that we just discussed that, insulin resistance is really the biggest driver of cardiovascular disease. And guess what? Our breast cancer patients tend to be more insulin resistant than our average population. So it really does connect the dots for us, that if we would just work with our breast cancer patients to reverse their insulin resistance, not only are we improving their cancer outcomes, but we are decreasing their cardiovascular disease risk as well. And I think Dr. Jeff Volek, who's now at Ohio State University, did a really nice analysis of comparing very low carbohydrate versus low fat diets and cardiovascular risk markers, and how much more dramatic the reduction in those risk markers are with ketogenic or very low carbohydrate diets. So I just feel like these are all interrelated. We need to be addressing the person and the metabolism, not the individual diseases.
Or not a particularly one-size-fits-all type of dietary approach.
Correct.
Yeah, well, let's keep going.
Reverse heart disease, the majority of patients, may save your life whether you have cancer or not.
So this one is interesting because it's a case study, so an anecdote from a very prominent academic at Cleveland Clinic, plant-based promoting sort of diet, showing actually the sort of angiogram-like view. And I'm afraid that if this were the case, we would have dozens and dozens and dozens of these kinds of reports, not just one. So in fact, I'm in the keto world asking people, if you have a result like this, let me know, and we'll publish it just as a, this can happen on other diets too. But again, this isn't a randomized trial. And then even then, if there's the old, because of it happened after something, it wasn't really because of that thing. After the fact, because of the fact fallacy, this could have been a process that was going to reverse on its own if it was soft plaque that would come and go. So anyway, the interesting arguing with a case study just doesn't persuade me.
No, and I do believe if you read deeper into that study, my understanding was that there was some loss of patients on the plant-based arm. And it was almost like if they had changes in their vasculature, then they didn't believe that they were, doing the diet properly, et cetera. So I think we have to be very suspect. And what I normally ask patients to do anytime they see something where they're, on plant-based diets or whatever. Try to find somebody who reviewed the study that has the opposite point of view. And the same goes for ketogenic. Like anytime something is out there that see the opposing discussion and then see what that discussion is. Because what I find that oftentimes, if it's supported with other data and other literature, as opposed to just other expert opinion, like let's look at the level of evidence and let's always question and ask, what is the opposite point of view?
I'm pretty confident that it's still happening there, but there is a low-carb keto available option at Cleveland Clinic. It's not just one. In fact, at Duke, there are many different types of dietary programs. There's not just a keto clinic. So that was the end. How would you give a summary of this video?
Well, I think that he has a lot of really valid points in that cancer is a big deal. We should all be attempting to decrease our risk of getting a cancer. I think that it is very much diet and lifestyle driven. And we should be using diet and lifestyle, but we should definitely be doing it, in my opinion, under the setting of metabolic dysfunction. So following one diet or following expert opinion and then judging diets based on that expert opinion is completely misguided. And we need to dig deeper under the hood.
Yeah, and get your own body tested under whatever approach you're using. I've seen people who followed an approach and then don't think that can be the problem because it was good for you. That's the classic, but I thought fruit was good for me. Well, no, it's actually making you gain weight and make your insulin go up. So in a different context, fruit may be good for you. In someone else's body, a certain plant-based, animal-based might be fine, but get it checked in yourself. We can do that. We can personalize medicine now like that.
Exactly.
Thank you so much for reviewing a video with me. I thought that was kind of fun.
Yeah, thank you.
Again,
Great.
Dr. Kesslering in the Chicagoland area, metabolic practitioner and radiation oncologist treating cancer and non-cancer patients. Thank you so much for your time.
Thank you.
If you enjoyed this video, be sure to like, subscribe, and hit the notification bell, and check out adapterlifeacademy.com.